Good afternoon, everyone. This is R.D. Whitney, CEO of the Validation Institute. I really appreciate all the people that have joined in today to talk about the Certified Health Value Professional program that we're launching. Next slide, Steph. So just to kind of set the stage and give a little background on who we are. Next slide, Steph. The Validation Institute's history came from a combination of Intel and GE. So they were coming out with a healthcare solution, and they were making a performance claim, a marketing claim about that healthcare solution. And as the hundreds of healthcare buyers that are on the call today, you probably see a lot of companies coming in with all types of marketing claims, some of them true, some of them are not so accurate. So the concept here was they were making a claim and they couldn't believe that they could pretty much say anything they wanted. There was no equivalent of United Laboratories in the industry. When you go into your kitchen and you flip over your crock pot, you see United Laboratories, so your house doesn't burn down. But that doesn't exist in healthcare. So the organizations got funding to create the Validation Institute. They brought in the best data scientists in the country, the health population experts that were focused in on the area of healthcare. And that organization got good traction. It was bought independently by a private investor who's trying to improve healthcare in America. I'm very passionate about that, part of the whole Conscious Capitalism Network. And he acquired this last summer. And we are starting to roll out these products and services and invest heavily in it to help the buyers of healthcare feel better about the companies that they're bringing in as benefits to their employees. But the thing that was stunning to us as we started going across the country and doing focus groups was the lack of education around the buying of healthcare. What we found as we were going out was there was no real formalized education program for the buying of healthcare. A lot of times, human resources and a lot of people with their SHRM designation on the call today, they don't get the chance to get an in-depth dive into all the areas of healthcare. So we heard that over and over again, that they were getting primarily their information from the organizations that were selling to them and frankly make more money when rates go up. So we didn't see any way that healthcare is going to change if that's the case. And we believe strongly that healthcare can change by the power of the purse. So the Validation Institute helps those organizations validate the companies that are coming in that they're looking at buying. And they help educate now the buyers of healthcare through our new CHVP program. So next slide, please, Steph. So we started asking sort of a lot of questions on if we were to deliver a healthcare education, healthcare buying education, what would it look like? And through our network and through many focus groups around the country and through the help of some of our great healthcare experts like Brian, who I'm going to introduce you to in just a few minutes here, we were able to identify the experts in the country on all the particular areas of high performance healthcare, the areas that are helping corporations save substantial costs and improve quality for their benefits that they're purchasing for their employees. So with that in mind, we've invested very heavily, brought in an infrastructure and a team to deliver this type of a program nationally and online. And we're going to get to the specifics of the program. But as you're kind of looking and listening about this program, think about one, the career advantage to you as a buyer of healthcare to have the letter CHVP after your name, telling your employer that you've taken the time to dig into each of the particular areas and learn about high performance healthcare. And also think, how this is such a needed area in the corporations. I'm sure you're hearing it from your employees and from your CFO and from your heads of HR, that there's so much change going on in this area, and there's so many techniques, and there are fantastic case studies to learn from. So we've brought all that together. And then next slide, Steph. And but before we dig into the particular areas, I want to introduce Dr. Brian Klepper here on the call today. Dr. Brian Klepper is with us at the Validation Institute. He's a nationally prominent healthcare analyst and commentator. He speaks, writes, and advises extensively on high performance healthcare, primary care clinics, and the management of clinical and financial risk. His current focus is on the high-performing healthcare organizations that consistently deliver better health outcomes at lower costs than traditional approaches in high-value niches. In his role at the Validation Institute, he spearheads programs that identify, validate, celebrate, and promote true high-performance healthcare programming. So with no further ado, I would like to introduce Dr. Brian Klepper.
Good afternoon, ladies and gentlemen. Next slide, please. To your left, you'll see the quote from Warren Buffett that everybody knows: "Healthcare is the tapeworm of the U.S. economy." And really, absolutely everybody on this call knows that, and has heard it time and again, and has been to 1,000 presentations where we talk about the woes of the healthcare crisis. A couple of examples that I like to point out. One is that there was a good study from Rand in 2011 that showed that in the previous decade, 79% of the growth in household income was absorbed by healthcare, meaning only 21% was available of new dollars for families was available for things other than healthcare, like infrastructure or transportation or education. It's a dreadful statistic. Another one is that if you're a company operating on the international stage, you have to overcome more than a 9-point disadvantage in GDP just to be on a level playing field with your competitors in Australia or Korea or Germany. It's a bar too high. Nobody can do that. So we are allowing systematically the healthcare industry to undermine the viability of our society, which is the bigger problem. Next slide, please. What can we, and the question is, what can we really do about it? The other point is that healthcare is a tremendously complex industry by definition. It has lots and lots of nooks and crannies. Very few people are knowledgeable about the whole range of activities going on in the supply chain, in care delivery, in finance, and in health IT. It's enormously, it's large, and it's complex, and it's filled with specialized knowledge. And that gives the vendors an advantage over the purchasers because they have intimate knowledge of the workings of healthcare business, and purchasers tend to have limited knowledge. So it's an uneven match. One of the goals of this program that we're describing is for healthcare purchasers to gain a solid grounding in many of the key areas of healthcare business that we'll describe, and that's really the main focus that we have here. Next slide, please. So what can be done? Next slide. What we're really trying to do is provide a platform for very easily accessible, powerful training that really gives you a grounding in the things that you need to know in order to understand the performance of different healthcare organizations, to plan your own benefit designs, and to pull them off, to operate in the marketplace, to understand the nuances of the industry, and most importantly, eventually, to identify and deploy and monitor truly high performance organizations that are providing better health outcomes and at lower cost consistently, so that we can gradually improve healthcare at a systemic level. Next slide, please. Here are the list of modules that we have realized so far. There are 14 of them. We think this is just the start, but this is the most important group. So let me go through each one and sort of make a comment on what it's about. The first one is establishing worksite primary care and steerage arrangements. This is about on-site and near-site clinics that offer employers a way to provide superior primary care and greater control over the downstream care that's delivered to their populations. They're complicated, but when they work, when on-site and near-site clinics work, they can deliver breathtaking results. It's really true. The next one is identifying and monitoring high performance healthcare services. There's a new crop of healthcare organizations. I've been very focused on this for the last several years. And these organizations consistently deliver way better health outcomes and or lower cost in high value niches than conventional care. This module will describe this emerging niche and how it's shaking up the industry. Suffice it to say that legacy healthcare organizations have not been supportive of this area because they make more if it costs more, and these organizations are very intent on rationalizing their services. The third area is effective population health management techniques. This module will focus on the ins and outs and complexities of managing populations with an array of conditions. I think probably most everybody on this call is familiar with at least the concept of population health, but as we all know, it's also a very complicated area to manage. The fourth area is direct contracting. We want people to become familiar with employers and unions that are going around their health plans and cutting favorable deals directly with the providers. This module is really focused on the do's and the don'ts of that approach. The next area after that is optimizing drug spend. Drugs are now costing 20% more of total spend, and it's an environment that's mostly opaque and designed to befuddle purchasers. What we've done is focused on a module that will define the principles of maximizing and managing this critical area. And as we all know, the area of specialty drug, which is part of this, is one of the most worrisome areas because it threatens to be 50% of total drug spend within just a couple more years. After that, the next one is managing bundled pricing, reference-based pricing. Reference-based pricing is tying reimbursement to a known reference point like Medicare. It's become a national effective tactic to reduce costs. It has gained particular acclaim in recent years with people like Marilyn Bartlett in Montana, and now a guy named Dale Foley in North Carolina, who are threatening to put the entire state employees' health plans of those states on a reference-based pricing model, and it has the hospital industry up in arms. This module will cover the basics of this approach, including the reputation that it's gotten for being contentious but effective. So it's top of mind as well. Bundled pricing, we're very interested in episodic case rates that are being developed in collaboration with providers, and that have become a reimbursement alternative that's gaining a lot of steam. This module reviews the logic and the practical applications of bundled pricing. Next is captive insurance arrangements. By collaborating with other similar employers, employers can often do a better job of spreading their risk and reducing liability over time. We're trying to provide the ABCs of this technique, and it's getting increasing popularity. Then there's stop loss arrangements. Those of you who've worked in this area for a long time know that stop loss arrangements are critical to guard against high cost claims, and it's typically an integral part of the health plan structure. So what we'll do is this module is what to look for and what to be worried about in putting together stop loss arrangements that can represent a very significant part of the entire health plan structure. Health benefits analytics. Analytics are an increasingly critical function for any health plan that wants to understand what kinds of risks it faces and how it has performed. I think that it's safe to say that organizations that in the past were not using health plan analytics, or that's going the way of the dinosaur. You can't manage a modern plan without really having competent analytics, and they've become almost commodities. Good analytics are available relatively inexpensively, and what we've done is put together a program that talks about what you really need as a basic and how to go about it. Next is self-funded health plans. Most of you are working with self-funded health plans. You have to be a certain size to be able to access them. But once you can access them, you have a lot of flexibility. More than half of all U.S. covered employees and their families get their coverage through self-funded health plans. So what we've tried to do is provide a thorough background on the structure and function and why they make sense. Next is optimizing your health plan's design and documentation. I think that this is an important area. This has to do with the fact that every organization has a summary plan document that theoretically shows that they're compliant with ERISA, the governing law over self-funded health plans. But most health plans are not optimized for the language that describes how they work or for the functions that they have. And the question is, how do you create an optimized self-funded summary health plan document? Next is medical claims review. This is an area that has a lot of different approaches that are now becoming well known: appropriateness and inappropriateness, legality and illegality of medical claims. But it's an area that offers a rich opportunity for recovering money that has been spent. Huge amounts of dollars are billed inappropriately and can be recovered, and without any disruption to the members. And that's a path that everyone should go down. Finally, we have a topic called CORA, which stands for Certified Outcomes Report Analysis. This is a methodology for evaluating and understanding healthcare vendor performance that was pioneered by Al Lewis. Many of you know Al, and is very effective and a critical tool. And we think that it deserves widespread dissemination, and we're offering it as part of this course. Next slide, please. Excuse me, I have to recover something on my computer. This will take me just a second.
Let me jump in there, Brian. So, just to get down sort of the nitty gritty here, the way that this works, the courses are all solid primers on key health benefit topics. It's a learning path. Think of it as an online learning path, and each of the modules are approximately 60 to 90 minutes of content. They're self-paced, so you can do this at whatever pace you want. You'll be sent an onboarding kit to be able to access the online learning system. It's a very intuitive system, and you can do it at whatever pace makes sense to you. Some people will complete the entire program in a month. Some people may take up to a year. There's a short exam at the end of each of the modules, and the purpose of that is to make sure that you've retained the information. And then there's a final exam on all the information at the end. So this is really intended to bring the education to the buyers of healthcare. And Brian, anything else you want to add there before I move on to the next step?
No, the only thing is we would emphasize that there are currently 14 modules. Students need to pass 10 to get the professional designation.
Great, thank you, Brian. And the Validation Institute and thought leaders like Brian that are part of the Validation Institute have helped us pull together this content from the very best educators in the country on the particular topics. So you're getting incredible education from the experts around the country in the convenience of an online program. So next slide. So we talk about this at the Validation Institute a lot, that there's probably no silver bullet to fix healthcare, to fix a very broken system that's, frankly, slowly bankrupting all of our companies and stealing our wage increases. And I'm sure you hear about the rising costs from both your CFOs and your employees. And we believe strongly that education from a non-biased source could really help make a difference here. We're near Boston area here, and there was for years a men's clothier company that had the slogan, "An educated consumer is our best customer." We believe that if this happens in healthcare, healthcare changes. Healthcare is probably not going to change by the politicians, probably not going to change by the organizations that are aligned and get more profitable when your rates go up and your services go down. We believe in educating the buyers of healthcare directly, the power of the purse, which you hold in your hands as buyers of corporations. And we have over 300 corporations from around America on the call today, and we've been inundated as we've started talking about this program. So we're very, very excited about that. So we do three things. We validate, which I told you about, where we can help validate that marketing claim of that point solution that could be coming in trying to sell to your organization. Is it true? Well, we do that. We help organizations get to the point where we can validate their data, and that saves you time. There's no cost associated with that. That's just a service we provide. In fact, the tie into Walmart there, the person who conceived the Validation Institute is now the head of wellness at Walmart, and they prefer validation for companies before they talk to them. So validate and educate. You know, educating, bringing the education to the buyers of healthcare, we feel is very important, and bringing it to them in a very unbiased way. So a couple of points here. There's some people have noticed this already, but there's a chat box on here. Feel free to continue to ask questions to us. We're also going to send you a recording of this after, and we're going to, if your question doesn't get answered, we're going to send those back with answers to everyone. But we have a couple in already. Brian, you good to take a few questions here?
Sure.
Great. So this first one, I'll point to you, Brian. It's Joanne from Cincinnati. She said, is this for someone that's new to benefits, or is it for an experienced benefits manager? What would you say to that, Brian?
Well, I think clearly anybody who's a novice at health benefits is going to benefit tremendously from this. But even the most experienced benefits managers, you know, will find a lot of benefit from going through the modules. The module, for example, on captives. Captives have recently become very popular in group healthcare. The module on high performance healthcare, that's a new trend as well. So we're pretty sure that everybody can benefit, and it's worth a good look.
Great. Actually, it kind of related to that. A question just came in from Texas, and it's actually on the advisor broker side, and they asked, you know, would this be helpful to the broker? Absolutely. We've gone around the country as we've been doing these focus groups with the buyers of benefits, and we've certainly been talking to the advisors. So they're the conduit to the buyers of healthcare. And we've received a really warm reception on this concept. A lot of people are interested in coming in it. And the advisors have said to us, you know, thank you for doing this, because when I go into a company, it's really great to have the potential customer be educated on all these particular topics, and everybody be at the same level of understanding. So that's a great question there. There's another question here. If I take the course, am I in a position to be able to evaluate and understand a vendor's claims if they're not certified by the Validation Institute? Great question. I'll just grab that one, Brian. So the Validation Institute does provide that service for the solution providers, but you're going to face a lot of companies that come in that don't have the validation. We do think it'll be a growing thing and a growing service. But for the ones that don't, that's what the Cora module is all about. It teaches you to be a better buyer of that service and understand and be able to understand if that marketing claim is accurate. So help reduce mistakes in bringing partners on board, and certainly help reduce costs. Brian, another question here for you. Oh, well, when would the program be live for me to start learning?
I believe that the date is April 27th that we've designated for releasing the program. We have most of the modules complete and ready to go. We're still realizing a few of them, but they'll come in very, very shortly. So it's pretty much right away. We're ready to go.
Great. And while you were saying it, I just got a text from our operations director confirming that date. So you'll receive an onboarding kit at that time, which will take you right into the learning management system. Again, it's very user-friendly, very easy to do at your own pace, stop and go, however you like to do. We've got another question in here from Orlando, Florida, from Robert. Do you offer corporate enterprise discounts if I want to purchase multiple CHVP certifications for my staff? Robert, good question. We've really only been talking about this program as far as being ready to get involved in for the past 2 weeks. And we went in front of a small group of HR professionals in the Boston area here, and we immediately got a group that wanted to take this for their entire HR department of 4. So we absolutely, the intention here is we are a mission-driven organization. And we believe that the power of this education can have on healthcare. So we try to make it very easy for you. And we can talk about pricing at the end. Brian, a question about how long does a student have to access the course after purchase?
A year.
Great.
We don't think that anyone will need more than that. As you said, a lot of people can access it and be done within a month, but it'll take some people longer. But we think that a year is gracious plenty.
Great. Susan in Austin is asking about, is there a return policy? What if I get into the first module and decide it's not a good fit for me? I'll take that one. 100% guarantee. If this isn't for you, we would much prefer to give you 100% of the course cost back. So no questions there. It's 100% fully refund guaranteed. Another question for you, Brian. What if the healthcare laws and regulations change? There's certainly a lot of talk about change. Will the courses be updated with the new information as applicable? Especially if you do decide to take a longer period of time to do it, how will the students be notified that the changes have been made, Brian?
Yeah, first, it's worth understanding that the content developers for each of these modules are active practitioners. So for example, the reference-based pricing module was developed by Woody Waters, who was one of the founders of ELAP, which is the industry leader in reference-based pricing. The reviewers are people who also have subject matter expertise in those areas, and they review each module for bias, for accuracy, and for comprehensiveness. So we've taken great pains to make sure that everything is accurate. We will be focused on tracking information change in each area that we've got modules for, and we will be responsible for having those modules updated, and we will also notify all of our students that there have been updates, and then we will do an automatic review of each module topic every 2 years. So we're pretty dedicated to this.
Thank you, Brian. I see we're coming up to the end of the half hour here, and really appreciate it. It seems like everybody's staying on to the very end. So let's get to the very last slide here. And as we're transitioning to that slide, my email address is rd, that's rd.whitney, WHITNEY, at validationinstitute.com. That's rd.whitney@validationinstitute.com. Any questions that you don't want to put into the chat, just feel free to email me. If you are interested in getting involved in this, of course, we're the inaugural class that will be part of the April 27th launch date. We're making it very inexpensive. We're reducing the cost by $300. So it'll be only $895 to go through this entire program for you. So it's a really good chance if this is of interest to you and you want to dip your toe in the water with it, go ahead and sign up, get a really nice discount on doing this. You'll receive your onboarding materials at the end of April, and you'll be off on your way. And like I said, at any time, if this isn't exactly what you wanted, we're happy to refund it. We're a mission-driven organization to try to get this great education out and keep it updated. So please, also, we love criticism. So please, any other sort of thoughts or ideas on how to evolve this program? We're really excited about this. And there's this slide with my email address. Please send your thoughts in. I can guarantee you every single email will make it to the thought leaders of the Validation Institute. We love your feedback, thoughts, ideas, partnering ideas for the advisors on the call as well. And we hope to see you soon as we come across America with this message in this product, and hope to see you both online and live. So thank you very much for all your time, Brian. Thank you for your time today. And
thanks for coming.
Great. All right, with that, I'll close the webinar, and everyone look for the recording and the questions and answers to follow. Thank you so much for your time. Have a great day.
Be well. Bye-bye.